So today I'm pleased to have with us our presenters and faculty members, Rachel Ellison. She is a nursing instructor as well as a faculty and health services administration program coordinator at the University of Louisiana at Lafayette. And she's been teaching in higher education for 10 years with a focus on healthcare policy, healthcare finance, as well as healthcare leadership. Her colleague, Lesley Clack, is a nursing instructor and is the Master of Health Administration program at the University of Georgia. She too has been teaching in higher education for 15 years and has a focus on health policy, healthcare management, as well as organizational behavior. I want to welcome Rachel and Lesley, and now I'm going to turn the presentation over.
Hi, everyone. Thank you for attending this webinar on our book. We are both very excited to have the publication date very near. We took a lot of time to make this book, write this book, and create it for all of you. So let's talk about policy and the current issues in policy. What we decided to do with this textbook is really think about what was the most important things that we wanted to add to the book. Everything including Medicaid funding with the state and the federal, and the constant changes in healthcare. We all know that healthcare changes daily. Actually, right now, I'm sure we are realizing that more than ever with this coronavirus situation. Also, the changes in political parties, which happens also more often than not. When one political party takes over, they change how they see healthcare and how they want to change different policies and do things their way compared to how it was done previously. And also the advancements in healthcare technology. We've seen over the years with EHRs, medical records, and with HIPAA even, and how those things have evolved over the years and how that plays a role in different policies as well. And then with the Affordable Care Act, when that came into play, all policies had to be changed, rewritten, who was going to be included in the Affordable Care Act, who was going to be allowed to get what services, and et cetera. Also with different insurance companies, there's a lot of policies with that, and their own policies actually, who gets coverage, who does not get coverage. So when we decided to write this book, we wanted to make sure that we were covering a variety of different policies, and we wanted to ensure that instructors had an array of different topics that they could discuss in their courses. Lesley?
So I just wanted to provide a little bit of additional information as to why Rachel and I chose to write this book. Rachel and I both are faculty in health administration programs, and we both have taught health policy courses for years. And we kind of share the same sentiment that health policy courses can be both extremely exciting to teach and frustrating at the same time for the same reason. That being that information is constantly changing. And so while that can be exciting because you can refresh your course information and keep it new and keep it up to date for students, it also can be frustrating, specifically when you're trying to find textbooks. We often found that by the time you select a new textbook, that the information in it related to health policy may have already changed. And so that is part of the reason that we wanted to write this textbook, but also that we chose the particular design that we did. So as we talk about the design of the book on future slides, that just gives you a little bit of backdrop as to why we chose this particular design for the textbook.
Okay, so why should instructors and all of you choose to use this textbook in your course? So it features real-world case scenarios that are applicable to a variety of different professions. And we wanted to make sure that we did this the right way. What I like to do in my courses is always provide real world scenarios, and I do this in every single one of my classes. I feel like the students really like this when you can explain things by a real example. And so when we were writing the book, we wanted to ensure that we did this with our case studies. So the book does two things. We provide content in health policy, and then we provide scenarios where that content can be applied. The way the book is broken down, and we'll talk about this in future slides, but it is laid out so well where the didactic content is first, where we explain, all the different things within health policy, with the Medicaid, Medicare, CHIP, social determinants, everything that you want to know, everything that the student will need to learn. And then at the end of the chapter comes the case studies, the real world scenarios, and the students will read those, and then they can work together to discuss them. And it's just a great layout, and just the examples that we have in the book with the case studies are multiple authors that helped us out with the case studies, the variety of different case studies, all these real world examples. It's just a great variety, and you guys will see that when you get a chance to look at the book. And we filled a current gap by writing a text that contains current health policy content that can be used in many healthcare fields in a case study format. So, we teach healthcare administration, and we've taught health policy courses, and this can be used in nursing courses, this can be used in health policy courses, this can be used in health management courses, and it's used in a variety of these, and we wanted to ensure that we did this, that we just did not pinpoint it to one field. Lesley, do you have anything to add?
So that was a great explanation, Rachel. That was going back to what I was mentioning, in that we chose this design of this book for the specific reason of health policy information changing all the time. And so we didn't want just didactic content, because that is constantly changing, and we need to have other ways that we can apply that information so that instructors can add in the new things, but also have opportunities for students to be able to have applied situations. So that's where the case studies come in. And I know that many books do offer case studies, but it is such a focus in this book that there are 3 case studies in every chapter. So that's 42 case studies in the textbook that provide a lot of opportunity for students to be able to have really an interdisciplinary applied method for being able to really understand the health policy information and being able to really apply it in different scenarios and situations. And so we feel like this was a great approach to be able to keep the didactic content focused in a historical nature, and have some opportunity for instructors to be able to just bring in whatever changes have been made, and then students can then apply both the historical piece and the new changes to the case studies that we have for each chapter. Next slide.
Okay, so about the textbook, it is divided into 5 different sections. In each section is a focus. The first, introduction to health policy, and I believe in the next few slides we'll go over those, but it features 14 chapters. Each chapter has an introduction and summary that leads to the case studies. Like Lesley was saying, each chapter has 3 case studies, basically on the what the chapter topic is about. It contains 42 case studies that help students to critically think about different topics and scenarios that affect many in healthcare. And I'm telling you, it took us a long time to go through these case studies, and we were critical when we were going through them and reading them, and what we decided to put in the book, they are fantastic. And I'm not just saying that because, you know, it's a book that, you know, we wrote and edited and all of that, but honestly, these case studies, the students will love them. They are interesting, they are unique. Some of them you will read them and laugh at because they are funny, and the students will really enjoy them, but they will engage the students, they will critically think, and some of them will probably hit home with a lot of the students and think, wow, this could happen to me, or this has happened to me. But it will bring great discussions to the classroom, and they are great case studies. This is an interdisciplinary approach, this book, the case studies. It can be very much an interprofessional course. It's great for health services, administration programs, nursing programs, and it can both be for undergraduate and graduate programs. I don't really see this textbook being for one or the other. It really can be used in both. I don't see it as being just for one because of the way that the book is laid out with the didactic and the case studies. It would work for both. Lesley?
Yeah, that's a great point, Rachel. So if you wanted to use it for undergraduate versus graduate, you could just do that based upon the assignment that you give them for the case studies. So for undergraduates, you know, perhaps you require less pages, a smaller analysis. For graduate students, maybe you require them to do a more in-depth case study analysis, require them to do further outside research. So they really are very applicable to both situations. In addition to what Rachel said, I just wanted to add a little bit about the case studies and the interdisciplinary nature of those. We had some 25 different professionals who wrote these case studies. We have professionals who were nurses, nurse practitioners, lawyers, health informaticians. So to say that they are interdisciplinary in nature, they absolutely are. They were written by people in all different professions. And so both of us feel that this is a very unique aspect to this text that really makes it very applicable to any program that has a course in health policy, because there's going to be specific case studies written by professionals in those particular fields that are going to be very applicable, as well as your students will be able to learn from professionals in other fields. And so that's really a great unique feature of this particular textbook. Next slide.
Okay, so the next two slides are just a breakdown of the textbook. And so you'll see how each section is set up and each chapter. So basically here, the first section is the introduction to health policy management. And then you'll see that's chapter 1 through 3. And then section 2 is understanding the U.S. healthcare system, and that's where all the financing and payment methods come into play. And then section 3 is the government-funded programs such as Medicare and Medicaid and the Children's Health Insurance Program. And then on the next slide, section 4 is the access to care, where we really look at the social determinants of health and the individual rights. And chapter 10, we really discuss the uninsured and underinsured population, and there are some great case studies in this section. They really ask a lot of great questions, and that's another thing with the case studies. Every case study comes with discussion questions, and they're great critical thinking questions. And section 5 is the critical issues in health policy. Lesley, do you have anything to add about these slides?
Sure. So I'll just add kind of how we selected the particular chapters that we did. So while this is a health policy book, we're taking what we call a health policy management approach, which is very applicable to healthcare. So we're thinking about nursing, other allied health disciplines, health administration students who all could utilize an understanding of how to really manage health policy. So not just what health policy is, but how is it really managed within the healthcare spectrum. So in selecting the chapters for the book, we were really using that type of approach and kind of thinking about it from that perspective of we want to go over the basics of health policy, but then we want it to be very applicable to the healthcare field. So that's why we have some of the additional chapters that are very much focused on healthcare, like medical ethics and healthcare professionals and individual rights and those things that are very applicable to healthcare. That was the reason for the inclusion of those. And all of those case studies then can combine both those topics with health policy to give students the opportunity to be able to apply those concepts. Next slide.
So now we're going to talk a little bit the case-based approach and why it's so important for this textbook and why we decided to do this. When we were first thinking about writing this book, we knew that it was important to add the didactic content, but I think at first I was like, no, no didactic content. I just want a full textbook of just case studies because I love using case studies in my course, all of my courses, and I teach a fully online program. But then, after discussing it, it was decided that we needed to add some didactic content, but we wanted a full, heavy case study book still. So the case-based approach is an important feature of this text because the approach engages the learner to critically think about the topic. So the topic is very clear in the book based on the content, the didactic content, and then we go straight into the case studies, which there are 3 case studies. They are very different in every chapter, but they are also very similar, within that same chapter. But the student will see how they are similar but also different by the similarities of the topic in the chapter. But they will engage the students and they will have to apply what they learned from the chapter content when reading the case study. Lesley, do you have anything?
Sure. So we did provide at the end of the textbook a little bit of guidance for students on how to write a case study analysis. Many students often, if they've not taken specifically healthcare or healthcare management type courses, may not have done this before, but this is a very common approach in healthcare courses because students really need an opportunity to be able to hear about a real life situation. And most of these cases are written based on real life situations that all of us who've been in the field have encountered. And students need to be able to hear about that and to be able to think about, okay, put their critical thinking skills to work in how would I respond in this situation? What does this mean? What recommendations would I make if it's a policy type question? So for each of the case studies, there are discussion questions for the students to answer. And so what's typically recommended, what we kind of recommended in the guide that we provided is, that you have students provide a summary of the case for them to answer the questions within their paper, but also to provide their own insights, their own analysis, and some outside research to back it up. So we provided a little guide for students who are not familiar with case study analysis so that they would have some idea of kind of how they should write this paper. And of course, faculty, you can adjust this however you would like. So you can have students can complete the case studies in groups. You can have them do it individually. You can have them select one and present it. So you can certainly use these in any variety of way that you would like to. And that's why cases are so good, because there's so many different types of application for them that are really helpful to students. Next slide.
Number 2, it can be used in a group setting. Just like Lesley was saying, faculty can use the book and the cases in a variety of different settings. The cases are perfect for working in a group, in online groups, in traditional face-to-face settings. They can choose which case that they want. There's discussion questions that come with every case, so it's great for a group setting. Lesley?
Sure. So I'll just give 2 different ideas of how I use case studies in my classes. So I traditionally have always let students sign up for cases, and each student would provide a case study analysis, but they would have to present it to the class. So they would do a presentation of their case study analysis, of their solutions and recommendations for the case, like a 15, 20-minute or so presentation for the class. But this past semester, I decided to do something different. I wanted to do more of a flipped classroom approach, where I had students basically teach the case to the class, go through it and engage the class in discussion. So it really works either way. You could do it either way. And it might depend on whether or not you have undergrads or graduate students. You also, can incorporate multiple case studies throughout the course of a semester, especially if you're teaching like a 16-week course. You could have them do, I typically over a 16-week course would have them do like 4 different case studies. You can also, since there's 3 for each chapter, what you could do is every week in class, you could have one that's used sort of as a discussion and backdrop in class, so that students, can hear how we as faculty work through a case study and we discuss it together. And then you have 2 other ones that could be used for homework or for presentation for a student, or you could have them work in groups. So there's just, again, a lot of different methodologies that you can use, and there's a lot of flexibility there with the case-based approach. Next slide.
And number 3, it is useful in both the online and traditional classroom settings. And I think I mentioned this before. I teach a fully online program, and I believe Lesley, she does both online and classroom settings. And just like her examples she was talking about, she has used this in the traditional classroom settings, and I have used it in the online setting where I have put my students in groups and gave them a case, and they have successfully worked it out via online. So it definitely can be done in both settings, and it works, and the students critically think and they apply what they have learned, and it can be done successfully. Lesley, do you have anything?
Sure. So yes, the 2 examples I was just talking about were both from a traditional classroom setting, but I also do teach classes from time to time online. And online, there's a couple of different ways you can use them. So if you're teaching online and you're using discussion boards, you can use a case as a discussion board feature, for students to be able to work through the discussion board, or it could just be their assignment, their paper, or whatever that they're doing individually. Or you could have it sort of as a group discussion if you set up kind of group discussions and group chats or something. So I think they work very well for both traditional and online classroom settings, to give students a methodology for really engaging with the material. Because again, with these case studies, they can do outside research. So that is getting them really to dig deeper. They have questions to answer. So there is a guide to it. With the questions, they have to come up with the questions. A lot of the questions, the textbook information, the didactic material is connected with it. So they have the material and text that they can use. They can also go engage in outside research to be able to answer these questions. And then they can really problem solve and critically think to be able to come up with really inventive solutions to the problem, which is really what is so great about a case-based approach. And all of my students, whether they love having to write a paper or not, they might complain about the length of the paper, they all really like case studies and do benefit from case studies, because it is really one of the only things that really gets them thinking about, what do I do if this happens when I go out into the real world? And so often they will say, that they feel more prepared when they're in real world situations because they remember doing a case that was similar. And so then that's something that kind of sticks with them. So it's really just a good learning approach. But by also having the didactic content, then that allows them to be able to connect the two. So connect the historical health policy information and apply it in the case-based scenario. Next slide.
Okay, so incorporating this text into the course. What I like about this textbook is that it can be used as a primary or supplemental resource. So you as faculty can decide if this book will be the only one for your course, or it can be a supplemental, and maybe you can just use the case studies as a supplemental for the course. As a supplemental text, use this to implement the flipped classroom approach. Like Lesley was explaining what she did in her course this past semester. She let the students teach the discussion or the case study in her course. And it can provide cases for group work, and it does enhance student thinking and learning. So like in my course, I could see that I would use maybe another health policy textbook for more of didactic content. And then I would most certainly use this textbook as a supplemental resource because the case studies are so great, and it would be perfect to use for discussion questions. And that's how students would engage and answer the questions, work together. Same with the flipped classroom, which can be done online as well. Flip the classroom and have the students read the case study and present it as a group online, and have the students watch the group presentation. So the book is great to be able to use it as a primary or a supplemental textbook. Lesley?
Sure, absolutely. It could be used as either one. From my own personal choice with this is the perfect book that I would use for a primary resource, because typically, in order to get the depth of case studies that we've provided in this book, you would have to buy a regular, or have students buy a regular textbook that just had didactic content, and then buy the case study books that just have nothing but case studies. With this book, you're getting both. And so it really cuts down the need for a supplemental resource or for having them buy more than one book, which with my university at least is a great benefit, because they're really have been promoting kind of trying to keep down costs to students. So with this one book that is very reasonably priced, they get both the didactic content that they can still supplement from outside research, which is what we want them to do, because we want them to build those critical thinking and problem solving skills. But then they also get the case studies. And so it really keeps from having to have more than one resource, which is more of a cost-effective approach for students. Next slide.
Some teaching tips. Effective tools or strategies for engaging students would be interactive discussions, case studies, and real-world examples. These are all things that we've actually already discussed in this presentation. So interactive discussions, very popular in online education, because we're always talking about keeping your students engaged. And I know that this is a struggle with online learning. Case studies have been proven to help keep students engaged, and also real world examples. In my courses, I am open with my students to an extent, of course, about some health struggles, health issues that some family members or myself have encountered, and some situations, that happen out in hospital, happen out in practice, and the students really learn from that, and then they take that and they think how that could affect them or their family members. So it's always been an effective tool to allow students to think about what could happen to them in the future or how they would deal with that, and then always discussing it. I think communication is such something that is lacking in a lot of areas, but any way that we can enhance learning and engage the students and communicate is the best way to help students learn. Lesley?
Sure. As Rachel said, we've discussed a lot of this already, but the design of the book really is very conducive to interactive discussions. I mean, case studies are great just to discuss with the class. Like I said, since there's 3 per chapter, you absolutely can have one to discuss every week. It makes your lesson planning easy because you've already got a case study that you can discuss, and you could even have the students discuss it. So have a student or two or a group that it's their job to discuss it, their assignment to discuss it. So it really lends itself well to flipped classroom type approaches. It lends itself well to interactive discussion type classes. And if you'd rather just have students do a lot of papers, it lends itself well to that. So really, there's a lot of different effective teaching tools and strategies that you can use that really work well with this book. There are so many examples in there and so many case studies that you could just focus on the ones that you feel are more applicable to your discipline. There's also going to be ones that really will allow you to have some sort of personal experience that relates to it, that you can bring that into the classroom. So I think there's just many different ways to use it. And that was really our hope, is creating a textbook that had a lot of different layers to it. And so you have a lot of resources at your disposal that you can use that make it easier for faculty when we're trying to create a very interactive applied type course for students that really appeals best to their learning. Next slide.
So why choose this book over the competition? It follows a case study approach. There's limited didactic content to allow instructors to add content to their teaching. This was really important to us when we were writing the textbook. It is a limited didactic content because we wanted you, the faculty, to be able to pull from different resources and your own research so you could add that to what you were lecturing that week. So there is just the right amount of content in the book, but we wanted you to be able to choose what you wanted to lecture on or what you wanted to add or what topic you wanted to cover, because we do know that, you know, health policy and healthcare, it's changing rapidly. It is evolving. And this text is very interdisciplinary. Nursing, healthcare administration, there's no limit to the healthcare field for this book. It can be taught in many different areas, and we wanted to ensure that we just didn't have it just pinpointed to one area. And like Lesley mentioned earlier, we had a lot of people help us out. A lot of professionals in many different areas help write the case studies because we wanted such a variety of professionals, a variety of different real life scenarios in the book. So it's a great book, and it has a lot of different things in it that I think that the faculty will love, and the students as well. Lesley?
Sure. So I will just add, with the didactic content, again, it definitely focuses on the historical piece of health policy, but we tried to keep it very focused so that you don't feel that this content is already outdated when the book gets published, which is some of the things that we hear from faculty sometimes, especially with books like health policy, when things are constantly changing, is you don't want for the information to be outdated before the students ever get the book. So really the design of this book allows for keeping the historical policy content, but each week, if you want to bring in a couple of readings related to your profession that are, within the recent year or two that are really new stuff, then it allows for them to have the didactic historical piece and you to still bring in a reading or two without feeling like you have to give them 10 different readings to really be able to get what they need, which I know many faculty have gone to that approach. So it was really thinking, how can you have a textbook that you can really use and get what you need from it and have not as much stuff that you have to add to really feel like students are getting what they need. So again, this particular book really allows for that. In terms of versus competition, like I said, a lot of your textbooks may have a few case studies throughout, but this one has 42, and so that definitely is a unique feature. On top of the fact that for many disciplines, in order to get case studies, you have to buy a separate case study book. Like students have to buy the textbook that has the didactic content and then the textbook that has just the case studies. With this, you get 2 in 1. And so I feel like there is not a similar book on the market in terms of exactly what you're getting from this textbook, and the fact that it's interdisciplinary. So many health policy books might be more focused to particular professions, whereas this one really is focused from a healthcare angle. So this one is more really focused on healthcare versus just being straight health policy, which I think is definitely different from the competition as well. Next slide.
Okay, so why will faculty love this textbook? The content is current and up to date. Just like Lesley was discussing, the text provides historical content on laws and policies that are the foundation to health policy in the United States. Just like she was saying, that's what the didactic is filled with. It's all the foundational information. It has everything faculty will need to enhance student learning. It has the didactic content, case studies, and discussion questions with answers. So this book is perfect for faculty. It has everything that you need all in one book. It has the didactic, case studies, and discussion questions. So if you are looking for one book that has it all, honestly, I would say that this is it. It would be perfect for you to add this to your health policy course. It has everything. Lesley?
Thanks, Rachel. Yeah, so I think faculty will love it because of as Rachel was saying, it's the flexibility. I mean, there is so much in this book that there's just a lot of flexibility, as we've discussed, into how you can use the case studies, kind of how you can design your course, how you could use it for either an undergraduate population or a graduate population. So there's just a lot. We tried to put a lot of different resources here so that faculty really have what they need to be able to build a course in the way that you would like it. We do provide you with sample answers for the discussion questions, so you have those readily available, as well as a sample syllabus that we provide. So we kind of give some ideas, but then, really there's just so much flexibility in how you can design this course that really fits for you. So this type of text was written this way because this is what Rachel and I, what we really prefer and what we like. And when we talk to other faculty, hear some of the same things of, you like case studies, but you don't want students to have to buy a separate case study book just to get case studies. You still want them to have some didactic content. So we really took all of those different pieces into mind when we were creating this book. Next slide.
Why will students love this textbook? Its real-life case studies bring differing healthcare fields to life. The text has an easy-to-read style. So what I like about the book and what Jones and Bartlett did when they were making it real life, I guess, when they were bringing it to life, we were writing the thing, and then when their team was putting it all together, they put it in just such a nice, easy to read style with the different sections and the headers and everything. So I think students will find it very easy to read and to follow along. I know I've seen some books that I'm like, I can't even follow along in this because things are so jumbled together. So I think students will really appreciate that. And also the appendix provides students helpful instructions on how to use the case studies, like Lesley mentioned a few slides back. There's great instructions on how students can write the analysis, on how to read the case studies, because some might not have ever used case studies before and how to read them and how to analyze them. And again, the real life, real world aspect to it, just students like that, like I've mentioned before, this is, you know, school and learning is one thing, but then going out there and being in the real world, it's a complete different thing, and they want to be prepared and they want to know what it is really going to be like. So if they can get some sort of sense of that, I think they appreciate it. And I feel like this textbook, it really does that. And as long as you can have those discussions and put them in groups and allow them to apply that and have discussions with you, the faculty members, and have discussions with their fellow classmates. And I think the students will really enjoy this textbook. Lesley, do you have anything to add?
Sure. So as I had said previously, you know, I always get positive feedback from students when using case studies, specifically healthcare case studies, because it gives them an opportunity kind of to hear about situations that happen in healthcare and then to think through how they would respond to these situations. I do think the text is written in a very easy to read style. It's laid out very well, didactic content first, as Rachel said. Then we did provide key terms with each chapter, so that's always helpful for students if there's terms that they're not understanding or that are not familiar to them. And then the case studies with the discussion questions, the guide to writing case studies in the appendix. So we tried to put all of the different helpful pieces in there. And like Rachel said, Johnson Bartlett really did a really great job of outlining this and laying it out in a very easy to read, friendly format for students. Because I do find with my students, I'm sure you all do as well, that the books that they like the best are the ones that are easy to read. Regardless of the content, they like the ones that are easy to read. If it's not laid out in a user-friendly format, it's going to make it more difficult for them to really engage with the content. So I feel like if you look at the sample chapter that was provided to you, that you will see that it's very easy laid out, easy to read, very easy to follow, and that will really help students to really engage with the material. Next slide.
We do have some faculty resources for you all. There is a test bank, PowerPoint slides, sample answers to the discussion questions, and there is a sample syllabus that will come with the textbook. Lesley, do you want to add anything to this?
I'll just say that, you know, I always find it helpful to have sample answers to the discussion questions. While you certainly can write your own answer, you know, that's helpful for faculty typically just to have something that you can use and then you can add to or detract from if you would like. So there are sample answers for all of the questions that come with the case studies. With the sample syllabus, it just gives you some ideas, you know, to start with and kind of give you like a template to start with. Certainly you can add to or detract from, but it just gives you an idea of kind of how you can use this case study format. So I know as a faculty, it's always appreciative, whether or not you use them or not, it's appreciated just to have resources so that you can look and see what are some things that you can use and try to make things easier for yourself. I know it's also very beneficial for new faculty and maybe for someone who's not taught this type of course before. You know, it's just easy, makes your life a lot easier to have some things that you can get started with. So there's definitely some great faculty resources that are available with this text.
Well, thank you, Rachel and Lesley, for that really informative overview about the new text and how faculty can use it, as well as some of the resources that accompany this product. It was really a pleasure having you on today.